This conference will now be recorded.
Hello students, I'm Dr. Divya.
Good evening.
Yeah, can you hear now?
Yes, ma'am.
Okay. In last class, due to some technical issues, we couldn't complete. So in the fourth chapter, we were learning about reproductive health, right? That means total well-being in reproduction. That is called as reproductive health, right? So there are so many awareness programs that which is initiated by government and private sector people. So counseling and creating awareness. This is the main or primary step which is towards the reproductive health, or to get a reproductively healthy society, we need to do counseling, or we need to create such awareness programs, or we need to give proper awareness among people about sexual practices, then reproductive organs, then diseases which are sexually transmitted, and these are the one and only initiation or step which we can take towards the reproductively healthy society. So for this purpose, different reproductive health and child care programs are there, which is initiated by government, and even private agencies are also involved in this. So we have learned about what is reproductive health, what is population explosion, then what is infertility, then sexually transmitted diseases, contraceptive methods. All these things we have learned, especially the main methods of contraceptive methods we have learned. Contraceptive method means it is not a compulsory method. It is just for reproductive, right? To avoid unwanted pregnancies, or to delay the pregnancies, or to maintain a gap between pregnancies. For that, mainly these contraceptive methods are used, right? It is available in the forms of pills also. And next, medical termination of pregnancy. That is legally permitted if it is fatal for the mother or the fetus, or for both. In that case, it is legally permitted, right? Otherwise, amniocentesis, we have already told, amniocentesis is just for the detection of diseases of the fetus. It is not for sex determination, but in our country it is misused. So legal permission is there for the termination of pregnancy if it is fatal to mother or the fetus. If such problems, any problems, health issues are there which is arising from that growing fetus, then it is legally permitted for termination. Otherwise, it is not permitted. Then we were discussing about sexually transmitted diseases. So, what do you mean by sexually transmitted disease? Like some diseases which are transmitted through sexual intercourse, that are called as sexually transmitted diseases. So, we'll move to that. Sexually transmitted diseases. So, the infections which are transmitted through sexual intercourse, they are called as sexually transmitted diseases. So, sexually transmitted diseases, that they are spread from one person to another person, or to one person to another person through sexual contact. Okay. So these STDs or sexually transmitted diseases, they are dangerous. Why they are dangerous? Because by seeing one person, or we can't make out by physical appearance, we can't make out whether that person is having a STD or sexually transmitted diseases or not. We can't make out that by seeing the person. So it is very dangerous because we can't make out by seeing a person that whether that person is having a sexually transmitted disease or not. So sexually transmitted diseases, they are infections spread from person to person through sexual intercourse. Then IV drugs. Then IV drugs and all in the last class I explained, right? The intravenous medications which are provided, they are provided in the form of solutions and injected to our circulatory system, blood circulation. So it will act on proper place. But for this injection or to give such injections, we are using needles or via syringe and some surgical instruments and all. Whenever we are using, through that also this sexually transmitted diseases can spread. Mainly this injection, the same needle which is used by an infected person is using for another person, there is a chance of infection. That's what syringe and all, this is spreading. Okay, some sexually transmitted diseases. Then, so the diseases are the infections which are transmitted through sexual intercourse with an infected person. They are collectively called as sexually transmitted diseases or STDs, or venereal diseases or reproductive tract infections. These are main points which you should remember. All are same: sexually transmitted diseases or venereal diseases or reproductive tract infections or RTIs. Okay, reproductive tract infection. So there are so many causative agents or so many pathogens those are becoming the reason for a sexually transmitted disease. Which are the agents or the pathogens which are transmitting this sexually transmitted diseases? Mainly they are bacteria, virus, chlamydia, then protozoa, nematodes, ectoparasite and fungi. These are the main causative agents of sexually transmitted diseases. Got it? Bacteria, virus, chlamydia, protozoa, nematodes, ectoparasites and fungi. These are the main agents of sexually transmitted diseases. Next, sexually transmitted diseases and the mode of transmission. The mode of transmission, they are transmitted in different methods or by different modes they are getting transmitted. So we have already told that through sharing needles, then surgical instruments, then blood transfusion from mother to fetus, then sexual intercourse with infected person. So in these ways, all these diseases, it is getting transmitted. So how it is getting transmitted? By sharing surgical instruments and needles, then sexual intercourse with infected person, then blood transfusion from mother to fetus. So all these ways it is getting spreaded or transmitted. Then how to prevent this sexually transmitted diseases? That is very important. Preventing a sexually transmitted disease. So prevention of sexually transmitted disease, that is the best way, right? It's better than curing the diseases. After infection, curing is difficult. So better to prevent such infections. Then how to prevent this? As we said, avoid sex with unknown or multiple partners. These are the points. So then using condom, using through via, it is spreading through intercourse, sexually transmitted disease, right? So that there is a chance of spreading this or transmission of this disease from an infected person while sexual intercourse. So better to use condom during intercourse. Then in case of doubt, or if you have any doubt, if the person is having any doubt, like there is a symptom or such symptoms are appearing, symptoms are seen, like, or they are having a doubt like any kind of disease, better to clarify with a doctor. Better to consult a doctor and clarify the doubts. So in case of detection, that means if it is found that the person is infected with a sexually transmitted disease, they have to take a complete course of treatment. They should not stop in between. The course should be completed. That is the main thing. The better way is to prevent the infection. Okay, so by chance there is an infection, they have to take better treatment, better to consult a doctor instead of keeping silence, better to take the advice of a doctor and to complete the course of treatment. So in the case of detection, complete the treatment. So these are the methods to prevent sexually transmitted diseases. So mode of transmission, sexually transmitted diseases are transmitted by different modes: sexual intercourse with infected person, then sharing of infected needles and surgical instruments, sharing of needles with an infected person, and then sharing of surgical instruments, then transfusion of blood from an infected mother to fetus. That is also a reason. Then how to prevent? Avoid sex with unknown partners or multiple partners. Then one should always use condom during intercourse. Then if a person is having a doubt that she or he must consult a doctor, a qualified doctor. Okay. Then STDs are detected. If it is detected, the person should complete the full course of treatment, and until recovering the health, they should take the treatment with the help of a qualified doctor. That is very important. Everything should be under the guidance of a qualified doctor. Got it? Next is different sexually transmitted diseases. So among sexually transmitted diseases, the first disease which we are going to discuss is syphilis. The syphilis, it is a sexually transmitted disease which is caused by bacteria. These are bacterial infection. The syphilis is a sexually transmitted disease which is caused by bacteria. It's a bacterial infection, and the causative agent or the pathogen or the bacteria which is causing syphilis is Treponema pallidum. Note down this agent, then diagnosis, the incubation period, the medicine which are used. These are the main or the symptoms, and these are the main points which I have given in this slide, because these are the main questions that appears in the NEET exam. For your NEET exam, for your board exam, I think there is no detailed explanation about all this disease in your NCERT book, but for your NEET exam, they will ask all these questions as MCQs. So note down each every point. First, the infection, whether it is caused by bacteria or any other pathogen. That is the first point you should note down. I have in the starting slide here, I mentioned different organisms or different agents, right? So you have to note down first whether in which category this organism or the agent is belonging to. That is the first thing. Okay, when I am explaining about the disease. And second one, the symptoms. Then incubation period. Then the treatment or the medicines which is used to treat the disease. Then the test. Here we have mentioned so many tests to detect this. Not for all the diseases. Wherever it is mentioned, you should note down. These are the 5 or 6 points you should note down in all diseases. Okay. So syphilis, it is a sexually transmitted disease which is a bacterial infection, and the pathogen is a bacteria. Which bacteria? Treponema pallidum. Treponema pallidum. That is the bacterial pathogen which is causing this disease. Okay. And the symptoms. What kind of symptom that shows? If a person is infected with syphilis, what kind of symptoms that shows? In the early stage, that means in the starting stage of this disease, on the genital, there will be appearance of painless ulcers. Okay, now done, painless ulcers will be formed in the genital portion. Okay, in the early stages, genital portion, painless ulcers will be formed. There is another disease where in the starting stage itself, ulcers with pain. So don't get confused. So such kind of simple questions they may ask for your NEET exam, that may be confusing. Okay, answer will be simple, but there is here in the starting stage, painless ulcers will be formed. But in that another disease, ulcers with pain, painful. Okay. So that is the simple difference, but you can get easily 1 mark. Okay. So in the early stage, on the genitals, painless ulcers will be formed. And after that, it is followed by swelling of the surrounding portion. Surrounding lymph glands will be having some kind of swelling. Okay. This ulcer will be formed, which is without pain. And after that, swelling of that surrounding lymph glands will happen. Got it? So in the next stage, so starting stage, ulcer formation, which are painless, then swelling of where it will form? Genital portion. Genital portion, there will be formation of painless ulcers, and after that it is followed by swelling of surrounding lymph glands. Clear? Then in the next stage, these painless ulcers are also called as chancre. They are called as chancre. These painless ulcers, it is afterwards, it will start, that healing process will start. Healing stage will start for this painless ulcers. Then the skin lesions. Skin lesions means if an organ or a tissue or a part which is having some kind of damage, and after that, the curing stage will start, no? Through that ulcer or wound, it is getting damaged, or it has undergone some kind of damage, then that skin lesions will appear. Okay. The skin lesions will be forming after that in the second stage. First, infection which are having painless ulcer, then swelling of lymph glands. Near to that, lymph glands will be present and that will be having some kind of swelling. And after that, in the second stage, the chancre is healed, and after healing, there is skin lesions. Skin lesions will be formed, and then forms rashes. Some kind of rashes will come, then hair loss also will happen. Okay. Rashes formation, hair loss. So these are the symptoms in second stage. The ulcers will heal, and after that skin lesions, then rashes, then swollen joints and flu-like illness. That's a major illness. Okay. Flu-like illness, that is a symptom in the second stage. It's not a continuous flu, but something like flu-like illness. And in the third stage, in the next stage, now second stage over, in the third stage, that chronic ulcers that may appear on palate. Palate means the upper portion or the root portion of mouth. Okay, the hard portion of mouth. the upper side, which is the hard portion, that is called as palate. So third stage, chronic ulcers may appear on palate. On palate also, ulcer formation will be there. Okay. That will be in severe form, and where it will form palate. On palate, severe or chronic ulcer may appear. So appearance of ulcer on this palate, then nose and lower portion of leg. Okay, on palate, then lower portion of leg. In third stage, what I'm saying, these symptoms you can see in third stage. And there is a chance of brain damage, then heart-related problems. The diseases which are related to heart. Then paralysis also. There is a chance of paralysis also. Okay. So in the third stage, appearance of ulcers on palate. Palate means the hard portion or the upper portion of the mouth. Then appearance of ulcer on nose. Then lower portion of leg. All these will be present in third stage. And there is a chance of heart-related issue. Then brain damage. Even paralysis also may accompany this. Okay. So how it is diagnosed? Now these are the symptoms what I explained. Next, how it will get diagnosed. So I said syphilis, it is a bacterial infection, right? Which is caused by Treponema pallidum. Correct? So it is diagnosed by clinical symptoms, then antibody detection. Through antibody detection also, we can detect this syphilis. And then ELISA test, and through microscopic examination also. Okay, through ELISA test also we can detect. ELISA is nothing but enzyme-linked immunosorbent assay. I'll explain that. Next, one more time it will come, so I'll explain. I'll give a short note about that. Enzyme-linked immunosorbent assay, that is called ELISA. So how we can detect or diagnose? By clinical symptoms, then antibody detection, then ELISA test, and through microscopic examination. And the incubation period, all these you should note down. It is diagnosed by ELISA, antibody test, then microscopic examination, then clinical symptoms. Then incubation period of disease, it is 10 to 90 days. For which disease? Syphilis, it is 10 to 90 days, the incubation period. Then the medicines, penicillin and tetracycline. Penicillin and tetracycline, these are the two antibiotics which is used for the treatment of syphilis. Got it? Penicillin and tetracycline, these are the two antibiotics which is used for the treatment of syphilis. So syphilis, it is caused by Treponema pallidum, and the symptoms are, in the first stage, there is hard, infectious and painless ulcer on the genital accompanied by swelling of local lymph glands. That is in the first stage. And in the second stage, that chancre is healed and there is skin lesions and rashes, hair loss, swollen joints and flu-like illness occasionally. Okay, that flu-like illness won't be there always. Occasionally it may come. So in the second stage, chancre is healed and the skin lesions will be there. Then rashes, hair loss, swollen joints and flu-like illness occasionally. And in the third stage, in the tertiary stage, this chronic ulcer appear on the palate, the nose and lower leg. And there is a chance of blindness and heart and aortic impairment, then brain damage and even paralysis also may happen. Got it? Then diagnosis. It is diagnosed by clinical symptoms, microscopic examination and antibody detection, ELISA test. Then incubation period, it is around 10 to 90 days, and treatment The antibiotics which are used for the treatment of this disease, they are penicillin and tetracycline. Penicillin and tetracycline are the antibiotics which are used for the treatment of this disease. Okay. This won't be there in your textbook. Note down. Please note down all these points. Then, here you can see the appearance or the symptom, how it will be. Okay. Under legs also this kind of marks will be there. Okay. This is how syphilis symptoms appears. And syphilis causative agent Treponema pallidum. It is a bacterial infection and this is the appearance. See, these are the symptoms. These are don't get confused. These are sexually transmitted disease. But if a person is infected, this kind of symptoms will be present. Okay. Next sexually transmitted disease is gonorrhea, and this is also a bacterial infection. See, now what I have explained, syphilis, that is a bacterial infection. Next is gonorrhea. This is also a bacterial infection. And the causative agent is Neisseria gonorrhea. Neisseria gonorrhea. That is the bacterial pathogen which is causing this disease called gonorrhea. Okay. In this disease or in gonorrhea, genital tube infection, that is the main symptom. The main symptom is genital tube infection. Okay. So due to that infection, around the genital region, pain and burning sensation may start. Okay. Genital tube is getting infected in this disease. So due to that infection, around the genital area or genital region, pain will start and burning sensation also may start. Okay. And along with that, pus-like discharge. Pus-like discharge also will appear, or the discharge of pus-like liquid that also may discharge from the genital area. So due to that infection around the genital area or genital region, pain and burning sensation also may start, and along with that pus-like discharge. Okay. And finally this will lead to arthritis also. So there is a chance of arthritis in the final stage. That if a mother is infected, a carrying mother is infected by this disease, there is a chance of eye infection in that growing fetus. Okay, don't forget, there is a chance of eye infection in the growing fetus. If a carrying mother is infected or affected by which disease? Gonorrhea, there is a chance of eye infection in the growing fetus. Okay. And diagnosis is mainly done by clinical symptom and gram staining. And gram staining is done with the discharge, pus-like discharge which is formed, and with the help of that, gram staining is done. So gram staining is nothing but it's a method to identify or distinguish different types of bacteria. Okay. Different types of bacterial species we can identify with the help of this gram staining. And it is a staining method. Okay. It is developed by, no doubt, it was developed by Danish bacteriologist Christian Gram. Christian Gram developed gram staining. That's why the name is gram staining. It's developed by Christian Gram. He's a Danish bacteriologist. And this method, through this method or through gram staining, we can classify the bacteria into two main groups. They are gram positive and gram negative. Gram positive bacteria and gram negative bacteria. Okay. So how that is done? Based on the cell wall constituents. Based on the constituents of cell wall that will absorb the stain which is used for the staining procedure. Based on that, gram-positive and gram-negative bacteria are separated. Okay, so the details of this gram staining procedure, the procedure of this gram staining and all, you can learn in higher classes. So mainly diagnostic method is gram staining. Then by clinical symptoms also we can make out. Okay, gram staining is done by using the discharge. Okay, then the incubation period is around 2 to 5 days. Here the incubation period is around 2 to 5 days. But in the case of syphilis, it was around 10 to 90 days. But here, for gonorrhea, the incubation period is around 2 to 5 days. And the treatment with the help of antibiotic like penicillin and ampicillin. Penicillin and ampicillin. So penicillin and ampicillin are the antibiotics which is used for the treatment of gonorrhea. Note down this medicines. Then incubation period 2 to 5 days. Then diagnosis. The method is gram staining. Gram staining can be used for gonorrhea. Okay. Then in gonorrhea, the causative agent or the pathogen is Neisseria gonorrhea. And the symptom, the infection mainly occurs in the genital tube. Then it produces a pus-like discharge along with the pain around the genitalia and burning sensation during urination. Okay, and this may lead to arthritis and eye infection in a child or in a if an infected mother that may cause the infection of eye infection in the fetus, growing fetus also. If mother is infected, that will lead to the infection, eye infection of that fetus. Okay, and diagnosis mainly by clinical symptom, then gram staining of this discharge and culture. Then incubation period, I said around 2 to 5 days, the incubation period. Then the treatment with the help of antibiotics like penicillin and ampicillin. Clear? Then in this you can see the signs and symptoms of gonorrhea. Okay, in female, abdominal pain or while doing intercourse, pain develops. These are the symptoms in female. In female, abdominal pain and while intercourse, pain. Okay, abdominal pain or pain with intercourse and vaginal discharge and bleeding. These are the symptoms in female. Abdominal pain or pain with intercourse, then vaginal discharge and bleeding in females. These are the symptoms of or signs of gonorrhea in female. Then in male, infected kidneys, then urinary tract infection, then burning sensation with urination, then inflammation of penile, then swollen testicles. Testicles will be swollen, then discharge from the penis. So in male, what are all the symptoms? Kidneys may get infected. There is an infection of urinary tract. With urination, there will be some kind of burning sensation. Then inflammation of the penile. Then testicles. Swelling in the testicles. Then discharge from the penis. That is the symptoms or signs of gonorrhea in male. Okay. Next is chancroid. That is a sexually transmitted disease. And this is also a bacterial infection. So the next disease we are going to learn is chancroid. This is also bacterial infection. And the causative agent is Haemophilus ducreyi. Haemophilus ducreyi. You should note down this point. The chancroid is also a sexually transmitted disease which is caused by bacteria, and the causative agent or the pathogen is a pathogen. The name of that pathogen is Haemophilus ducreyi. And the symptoms mainly appears in the genital region. That means on external genitalia, this symptom appears. Okay. See, at the site of that infection, we can see ulcers. Ulcers can be seen in the site of the infection. Okay. But these ulcers are painful ulcers. So in the case of syphilis, we said it is painless ulcers in the starting stage around the genital area or external genitalia, appearance of painful ulcers. That is the symptom of chancroid. Okay, that is not the symptom of syphilis, it is a symptom of chancroid. So sometimes bleeding also may occur from these ulcers. Okay, but there was no such symptom. Ulcer formation was there in the case of syphilis, but there was no bleeding ulcer in the case of syphilis, right? So these are the minute differences which you may not note down. That's why I'm asking you to write down everything and underline these separately, like there is a difference between the symptoms. These forms painful ulcers, and sometimes bleeding also may occur from these ulcers. Okay. Then, and the lymph nodes which are present nearby, that swells up. There is a swelling in the nearby lymph nodes. Okay. And the diagnosis can be done by clinical symptoms, and from these parts, discharge also may start. Okay. From these parts, discharge also may start. So the staining of this discharge and culturing of that also helps to diagnose. So the diagnosis, that method includes staining of this discharge and culturing. Okay, that also helps to diagnose. And which are all the antibiotics used for the treatment of this disease? Antibiotics like ceftriaxone, erythromycin, then ciprofloxacin, and trimethoprim sulfamethoxazole. Okay. Trimethoprim sulfamethoxazole. Okay. So these are the antibiotics which is used for the treatment of this disease. Okay. So the causative agent, chancroid is also a bacterial infection. This is also a sexually transmitted disease. And the causative agent or the pathogen is Haemophilus ducreyi, and the symptoms, there is appearance of ulcer at the site of infection. At the site of infection, and mostly external genitalia. On the external genitalia, these infections are appeared. Then it is a painful ulcer, the formation of painful ulcer, and sometimes it may bleed also. And nearby lymph nodes. The lymph nodes which are nearby, there may be swelling in that lymph nodes. Then the diagnosis mainly the clinical symptoms and staining of discharge from the sore and cell culture. Okay. Then the treatment, antibiotics like ceftriaxone, then erythromycin, ciprofloxacin, and trimethoprim sulfamethoxazole. So these are the antibiotics used for the treatment. Okay. Then this shows how the symptom appears for chancroid disease, which is caused by Haemophilus ducreyi. We can see here external genitaliar portion, the formation of ulcers. That's the main symptom which we have explained. Okay, this is the female genital portion and the male genital portion. In the external portion itself, you can see ulcers. Next is a very important disease, and now we have completed the list. So this is a very, very important disease, a viral disease, which is called AIDS. Okay, AIDS, acquired immunodeficiency syndrome, that is AIDS. And the causative agent, which is a causative agent or pathogen, human immunodeficiency virus, HIV, human immunodeficiency virus. Okay, so in AIDS, that means acquired immunodeficiency syndrome, the main symptom or the main problem is immunodeficiency. There's a deficiency in the immunity. So the infected person won't be able to defend any other disease because there is a loss in immunity. The immunity power is getting lost. If a person is infected with this HIV, the immunity power is losing. So the symptoms include fever, then lethargy. What do you mean by lethargy? Lack of energy. Okay. Always some kind of tiredness, like lack of energy. Then pharyngitis, that means sore throat. Actually, this is not a symptom of disease. It's like a symptom of disease. That is not a condition. The sore throat means it is not a condition. That sore throat appears like a symptom, as a symptom of some kind of disease. Okay. Then the diagnostic method, Western blotting, then ELISA, PCR. These are the main diagnostic method of AIDS. Okay. And ELISA just few minutes before I told about ELISA. ELISA means enzyme-linked immunosorbent assay. Actually, it is a biochemical test. ELISA is a biochemical test, and with the help of this, we can detect the presence of a ligand in liquid sample, which is directed against a protein. Okay. ELISA, the procedure and all, if I'm explaining also, you can understand. ELISA is a biochemical test. It is mainly a biochemical test. Okay. The presence of a ligand, it is detecting the presence of a ligand in a liquid sample. And that ligand is against a protein. We are detecting with the help of antibodies. Okay. And next is the treatment. There is no treatment for AIDS, and we can just give a support for the health with some drugs. This is the one and only way we can give health support just to prevent other diseases. Okay, because they won't be having immunity power. They are losing the immunity power day by day. So we can give supports. There is no treatment for AIDS. So this therapy means this supporting therapy, it is called as ART. ART is antiretroviral therapy. Antiretroviral therapy, that is called as ART, antiretroviral therapy. So for treating AIDS, zidovudine, then acidothymidine. These are the two drugs which we are using. Okay, acidothymidine, then zidovudine, then acidothymidine. These are the two drugs which we are using for the treatment of AIDS. So another drug which is used is diadenosine. Diadenosine is another drug, but that is not mainly used. Mainly we are using zidovudine, then acidothymidine. These are the main two drugs which are used in the treatment of AIDS. Okay. So acquired immunodeficiency syndrome or AIDS, the causative agent or the pathogen is human immunodeficiency virus or HIV, and the symptoms, most common ones include fever, then lethargy. Lethargy is lack of energy, then pharyngitis, that is sore throat, then weight loss, nausea, headache, rashes, etc. Then HIV mainly attacks the T helper cells. Okay, T cells. It attacks the T helper cells and the person is losing the immunity, or the person's immunity is unable to protect the body against any infection. The person is losing the body immunity. The person succumbs to any disease or secondary infection which normally would not have proved so fatal. Death is not due to AIDS. Okay. Then diagnosis. ELISA test and Western blotting. These are the commonly used tests for AIDS. Which are the main tests? ELISA test and the Western blotting. These are the main tests which are used to detect AIDS. Then Western blotting, it is mostly used to confirm the result obtained in ELISA. After doing ELISA test, the biochemical test, we'll get a result, and just to confirm that result, Western blotting is used. Okay. And PCR. PCR means polymerase chain reaction. That is coming in your upcoming chapter. One chapter you can learn about this PCR procedure. The whole procedure is there in your book itself. So that time we will explain what is PCR. Now the PCR also can be used for the diagnosis of AIDS. Next, the treatment. So we know that there is no treatment to cure this AIDS, but some drugs for support, or with the help of some drugs, we can prolong the life of the infected person. That's all we can do. There is no cure for AIDS. And this therapy is called as ART, or antiretroviral therapy. Antiretroviral therapy. That is called as ART. Zidovudin or acidothiamidine. These are the drugs which are used for the treatment of AIDS. Then didanosine is another drug employed to treat AIDS. Okay. Next, here you can see some information about HIV. And this includes some wrong information which are spreading in our society due to the lack of knowledge. See, people don't have exact idea or exact knowledge about this AIDS, right? So there are so many wrong information which are spreading in our society. So which are they? The ways HIV or AIDS is spread from person to person. In which and all way it is spreaded? Unprotected sex, then injection of drugs, then blood transfusion, then organ transplants, then pregnancy, childbirth and breastfeeding, then non-sterile medical instruments. These are the main reason for spreading this AIDS from one person to another person. Okay. So which is a viral infection, AIDS, which is a viral infection, which are the main reason for spreading this disease? Unprotected sex, then injection of drugs, then blood transfusion, organ transplant, then pregnancy, childbirth and all, then non-sterile medical instruments. Through these many ways, AIDS can be spread from one person to another person. Then HIV isn't spread through, HIV is not spreading through mosquito bite, then skin to skin contact, then hugging, kissing and all, then sharing foods or drinks that will not spread AIDS, then sweat or tears. Through this also AIDS won't get spread from one person to another person. Then sharing of toilet, towels or bed. All these won't cause the spreading of HIV or AIDS. So these are the wrong messages which are passed through our society, right? Through our society, these messages are spread because they don't have a proper knowledge how this disease is getting spreaded. That's why people are keeping away all these AIDS infected people. So through sharing the towels or toilets and all, this disease won't spread to another person. Mosquito bite, then hugging, then giving shake hands. That means skin to skin contact will never be the reason for spreading this disease. So there is no need to keep away this AIDS or HIV infected person from our society. Next is World AIDS Day. It's on December 1st. December 1st is World AIDS Day. And the red ribbon, here you can see the red ribbon. That is meant for raising awareness of HIV and AIDS and those living with that disease. Okay. The red ribbon is it is for the awareness of HIV and AIDS and those living with that disease. Okay. And this is designed by a New York-based visual AIDS artist, Caucus. His name is Caucus in 1991. Okay. And the main symptoms you can see muscle and joint pain, because I said there is no cure for this disease. It is day by day the person is losing the immunity power. So there will be muscle and joint pain. One or the other symptom will develop every day. And weight loss, severe weight loss will be there. Then increasing sweating. Then temperature increase. Then candidiasis of the oral cavity. That later I am going to explain about this disease. Then swollen lymph nodes. Lymph nodes will be having swelling. Then rashes will appear on the body. Then diarrhea. Diarrhea. Okay. Then liver enlargement. Liver enlargement. Then nausea. Then frequent viral infections, because the person, repeatedly I'm saying, the person is losing body immunity. So frequent viral infections, whatever disease, whatever may be, the person won't be having a capacity to oppose or to so there is no chance to get a protection, because already the person is losing the immunity power. So always one or the other kind of diseases will be infecting the person. Then drowsiness. So these are the symptoms: muscle and joint pain, weight loss, increasing sweating, then rashes, nausea, frequent viral infections, liver enlargement, drowsiness. Okay, World AIDS Day is December, it's on December 1st. Next is hepatitis B. Hepatitis B, the causative agent for this infection is hepatitis B virus. This is a viral infection. It is caused by hepatitis B virus, HBV. HBV. And the symptoms are fatigue, jaundice, then low-grade fever, which comes repeatedly. There won't be a continuous fever, but repeatedly it will come. Then abdominal pain also may occur, and in severe stage that causes liver cirrhosis and cancer also. Okay, hepatitis B may cause liver cirrhosis and cancer also. And the diagnosis include Australian antigen test. You may get a question. Australian antigen test, which is the diagnostic method of DASH. Okay, you'll get 4 choices. So don't get confused. It's for hepatitis B. So in severe stages, this causes liver cirrhosis and cancer also. Then diagnosis include Australian antigen test. And now it is called as hepatitis B surface antigen test. Hepatitis B surface antigen test. Then incubation period is around 30 to 80 days. These need more days, 30 to 80 days that need for incubation period, as an incubation period, and this disease is incurable. We can prevent through this is also incurable, but we can do vaccinations. Now vaccinations are available, vaccines are available, so we can prevent this disease. We can take vaccination. So hepatitis B, which is a viral disease, and the causative agent or the pathogen is hepatitis B virus, HBV, hepatitis B virus. And the symptoms are fatigue, jaundice, then persistent low-grade fever, continuous low-grade fever, then rash and abdominal pain. And this can cause cirrhosis. Cirrhosis means it's a kind of liver damage. Liver cirrhosis. Hope you have heard about liver cirrhosis and liver cancer at the later stage. Later stage that may lead to cancer also. Then diagnosis, Australian antigen test, which is now called as the hepatitis B surface antigen test. HBsAg, the AG antigen test, HBs, hepatitis B surface antigen test. Then ELISA. ELISA can also be used for the detection of hepatitis B. Then incubation period. Incubation period is around 30 to 80 days. And treatment. This is incurable. This is not curable. Then prevention. Prevention can be done with the help of vaccines. Now worldwide vaccines are available for hepatitis B. And hepatitis C is a secondary infection which occurs in hepatitis B patients. This can also be detected by ELISA. Hepatitis C. We are learning about hepatitis B, but hepatitis C is a secondary infection which occurs in hepatitis B patients. Okay, that also can be detected with the help of ELISA. Is it clear? Then hepatitis B, you can see same thing like needle. Through needles also this may come. Surgical instruments and needles. By sharing this, it may come. So hepatitis B mainly it affects liver. It causes liver cirrhosis and finally cancer also. That may lead to cancer also. This hepatitis B infection. It is a viral infection which is caused by hepatitis B virus. Now we can prevent this. It is incurable, but we can prevent the disease by using vaccines. Now vaccinations are available everywhere. Next is herpes, genital herpes. Okay, this is also a viral disease which is caused by the pathogen herpes simplex virus. Herpes is another viral disease. Genital herpes is another viral disease which is caused by herpes simplex virus. And symptoms, there are many lesions which resemble vesicles or which are later followed by clusters of painful erythematous ulcers over genitalia and perianal regions. Okay, I'll show you how it will appear. Like this, ulcers will be formed, which will be very painful, and the symptoms are more severe in females. These symptoms are more severe in females. Okay, and the infection of neonates can occur in the case of infected female. If a female is infected, infections of neonates that also can occur. A newborn baby can also get infection if the female is infected. And accompanied by this is fever. Fever, then headache, pain, itching, then vaginal and urethral discharge along with swelling of lymph nodes. So fever, headache, pain, itching, vaginal and urethral discharge along with swelling of lymph nodes. These are the main symptoms. And infections of urethra and cervix, that also occurs in the case of genital herpes. The causative agent is herpes simplex virus. And symptoms means many lesions which resembles vesicles. Okay. And there will be painful ulcers over genitalia and perianal regions. Then mainly this is seen in females. Symptoms are more severe in females. Okay, mainly this severe symptoms. It is seen in females. And infection of neonates can occur in the case of infected female. Okay, and along with this, fever, headache, pain, itching, vaginal and urethral discharge along with swelling of lymph nodes. Okay, that also may occur. And infection of urethra and cervix, that also may occur in the case of genital herpes. So there are so many other diseases also. So up to this, is it clear? If I'm explaining all diseases together, you will get confused. So up to this, it's clear? You have any doubt?
No, ma'am.
Is it clear? So note down all these points, especially the pathogen, symptom, incubation period, medicines which we are using. Okay, and the diagnostic methods. These are the main questions which may appear for your NEET exam. Okay, clear?
Okay.
So the remaining portions we'll discuss in the next class. You can leave now. Thank you.
Thank you.